Welcome to Healing Step to Wellness. I'm Dr. J,
I'm May.
your trusted guide to whole person health, one step
And one bite
at a time.
Hello, happy Friday.
Friday.
Yeah,
Yep.
love this. So,
It's-
what are we going to talk about, Dr. J? It's such a beautiful Friday. And such a
yeah.
beautiful Friday, not only Friday, but also beautiful June.
Yes, it's a lovely day to talk about inflammation.
Oh, why? But I love to walk. I love to do the gardening. I love to do a lot of things outside of the office and home in the natural. Why we need to talk about information?
That is a very generalized word. A lot of things tied to information. So information is a body signal telling you that something is injured and the body has to clean it up. So for example, when you overwork in your garden,
Yeah,
you,
okay.
you tear your muscle, tear a few
Okay.
fibers or your muscles or your tendon, ligament, and that's why you get sore or with everything like that. And the body has to come in to heal it. So either regardless that you tear the fibers or you step on a nail in the garden.
Oh, ouch.
Yeah, which I did when I was a kid.
You.
Yeah,
And
and
so,
I asked
so
my
okay.
sister to buy a Band-Aid, so my parents didn't know. But anyway, yeah.
You know what? I love that story because that's exactly the analogy that we used when we share with people in a community or our patient. We say that, can you picture you step into a nail and then you
Yep.
just put a Band-Aid on, which is that what you did exactly when in your child as a child.
Yep.
So I
Yep.
cannot picture how painful it could be. And
Very painful.
and what happened afterward?
I didn't want to let my parents know because I sneak out of the house, went to the pond. We had a fish farm. I went to the pond and I stepped on the rusty nail inside the pond.
Rusty nail.
And I didn't want my parents know, so I asked my sister to buy me a Band-Aid to cover it up. And of course, my sister said, okay, no problem. So she went to my parents to ask for money to buy Band-Aid.
Very straightforward.
Very straightforward. So my parents asked what's going on, took me to see the doctor, and the nail actually almost pierced through my foot. It missed the bones and went through just short of the skin on top
Oh
of my foot.
my,
It went
oh
through the
my,
foot.
oh my, oh
Oh,
my, ouch.
yeah, yeah, ouch. Of course, tennis shots, everything like
Did
that.
you cry a lot?
Oh, never cry.
Okay, that was a quiet experience. I
Right.
cannot picture the rusty nail and then to put a
Uh,
Band-Aid on. So it wouldn't, and so that is very simple to understand that it would never work if you try to put a Band-Aid on. Some body crying information or anything is just appear to be the symptom. You gotta
mhm.
treat the root cause, which you need to pull the nail out, clean up, and let it heal.
Right, right. So that no, not only the tissue got damaged from the nail, but there was also rust, metal,
Mhm.
and also it was in the pond, so there are a lot of
Yeah,
bacteria thing
yeah,
we didn't even know. So the body had to clean it up,
yeah.
and the process caused a lot of inflammation.
I
And
see.
what it does is that we know about the white blood cells, immune
Mhm.
cells. They have to come to the area to
Mhm.
clean up whatever the dead tissue or
Mhm.
potential bacteria,
Mhm.
anything pathogen. They have to clean it up, make it
Mhm.
clean,
Mhm.
and then they started to recruit
Mhm.
other growth cells to provide
Mhm.
growth factors to lay
Mhm.
down the collagen to build new muscles, everything. And this process is called cause inflammation. And you
Mhm.
have pain, of course, you have the swelling, you have the redness, you feel hot. And because all those chemicals we call cytokines or growth factors. They make the cells increase the blood flow over there. And so you can deliver more chemicals, deliver more cells to go there to clean up, to grow. And this process, and it also make it the blood vessels in the area more leaky, so that the cells can go out of blood vessels into the tissue. And that's why you also have the swelling over there.
Okay, so Dr. J, let me kind of put a pause on this a little bit. Where we kind of start our topics on the information. I know it's not just a word. People hear a lot of information, but I think based on your brief introduction, it kind of helped me link a couple things that I already see. I don't know if you can give us a more of a perspective from you as a very experienced podiatrist, also in incorporated lifestyle medicine, functional medicine, regenerative medicine approach to help people treat the root cause, but also kind of give us a general like the key topics. I mean, I would say under the information, what we normally see right now in getting into the nice season, we walk outside, and so there's some sign for us to pay attention and don't wait, get help.
That's a lot. So we're talking about information, what it is, what signs you have. But then this one, as I mentioned previous about the nail, that is acute information.
Okay.
It's very important that they initiate the healing process.
Yeah.
And that's healthy. The body needs it. If we don't have it, that's one of the reasons we have chronic wounds. For example, people with diabetes, pressure ulcer, something like that didn't heal because after a long period of time, the body just went dormant. And they just not doing anything.
Okay.
So one of the things we had to do, we had to debride the wound. It serves a few purposes. The number one, the dead tissue doesn't grow. And also that tissue doesn't have the immune system right there. So it's easier to get infected. But number three is really when we debride the wound, we cut into the good tissue. You will see bleeding.
Yeah.
But it's a process. We convert a non-healing wound into an active wound. So we reinitiate the wound healing process. So during that process, of course, when you cut out the old dead tissue, the wound looks bigger. And secondly, you want to get into a little bit of good tissue to make sure all the dead tissue is gone. But at the same time, you reinitiate the wound healing process. So in the old days, when I just starting out, people look at me and just say, I don't want to see you. You made the wound bigger. So, but that is a process of the debridement. That's the outcome you see. So that is a thing that the benefits of acute inflammation. But then the issue is when we get into the chronic inflammation, just like I mentioned about the wound, when it doesn't heal, or the wound stuck in the inflammatory phase, keep trying to clean up, doesn't go into the next phase that we will regrow the tissue, then there will be problem with the people. And the most chronic diseases we see right now is because people have inflammation inside the body. That's low-grade inflammation, and they affect a lot of metabolism inside our body. So one of the signs, for example, we will see during this summer active season is you go out, regardless your age, especially young kids, that you go out, you walk, and you feel like, ooh, my muscles are tired. I only walk 10 minutes, 20 minutes, but muscles are tired. And it may be say, oh, I'm out of shape. Maybe, but that's another sign of insulin resistance, which is one cause of inflammation. And the muscles are the largest organ using glucose. But when you have that chronic inflammation, you interfere with how the body will uptake the glucose. And that means the muscle cells are not getting the energy source, the glucose into it. And that's why when you walk 10 minutes, 20 minutes, or you try to play basketball, you just jump around a few minutes and your muscle just like, oh, I'm hungry. I don't have energy. I don't have glucose. And that's why we call it muscle fatigue, coming in too early. And that's the one easy sign for people to see, oh, I have insulin resistance, I have inflammation. There's something with this inflammatory process.
So the acute, it looks like, okay, so we have the acute situation, and I kind of relate to my recent incident was I got a bug bite, just as simple as that. And then just through that, from that bug bite, next day I got a swollen ankle, and it was so painful, hot, red, firm. So you helped me to improve that condition, and we can talk about later. It's just that we don't need to see the bloody wound, but there's a way that you can help reduce the inflammation on top of the mindful, healthy nutrition to help your body recover. And then number two, you talk about the chronic condition, the chronic inflammation. And so it just like suddenly we realize that, it's tricky, my body is not working the way that I expect. And then so there are several conditions. But also, I also can relate to, for example, we may continue to tolerate the very minor pain or discomfort. We get used to it. It could be our posture is not correct. It just continue your body. I kind of utilize one of you, the term they use, our body is trying to compensate that. So over a period of time, it's just like a gradually cooked frog until the time is until the situation get bigger and say, okay, I cannot tolerate that anymore. So I also can relate to that. So today you are going to take us to understand the chronic inflammation and what kind of the health condition can cause that, and then you are going to guide us how we're going to tackle on that. And I know this is a big topic, so maybe we need to come back to revisit it as some key big topics and to dissect more, to get more.
Right, the chronic inflammation, and that's the thing that a lot of things will cause inflammation. And but when you have that inflammation, because it's so low grade, your body can tolerate it. And so a lot of time is people just feel like I'm fatigued, not just my muscles. I just feel tired all the time. I may have the brain fog. Now everything sounds slower, and I'm starting to gain weight, just a little bit at a time. Now you don't see it very obvious, but it's trending upwards. And that's the time that the information is starting to build up. The issue is the lab tests. No, everything right now, technology, we rely on the labs. And then you go do your complete, your CMP, CBC, check your glucose, A1C, everything may be normal, or the doctor will say, oh, it's abnormal, but it's just a little bit. And that's the issue is everything just a little bit. And you can tolerate, and the so-called normal range is so wide. Even though you have a little bit of information, you're still falling into the so-called normal range. And that's why I always tell my patient, you don't want to be normal. You want to be optimal. Now, the glucose, the so-called normal is under 100, but you don't want to be normal. You want to be optimal, which is below 80. So something like that. And another, for example, I had a patient. I just received her lab results yesterday. You look at the glucose, normal. Look at insulin, normal. A1C was a little bit elevated. But then when you look at the so-called insulin resistance, how we calculate insulin resistance. So let's take your insulin number and your glucose number, put these two together, put into the calculation, you go formula, and it tells you the insulin resistance score. There's a gold standard formula. and she has insulin resistance right there. But then when you look at the lab, everything was normal.
You know what? I want to ask you a question, Dr. J. So when another thing that is, I kind of wonder that when I also heard that people say that my A1C, my glucose are in a normal range, and my doctor told me that I am fine. But but also, how did they get their number to fit into this so-called normal range? Is by medication only, whether they are doing their best from the lifestyle intervention. I kind of question about that. The two approach probably make a huge difference on how you interpret the number as well.
Right. But it's not that always bad to have medication. Some people do need medication. So, for example, glucose. If someone is born with type 1 diabetes, they need insulin. People like me who was born with high cholesterol, we need medication. So it's not that always bad to have medication. But the vast majority of people do not have those genetic problems. And that's what we refer to, that they control their lab with medication. That's what we call is managing the symptoms. That's when managing symptoms. It's not treating the root cause.
That's a Band-Aid.
That's a Band-Aid. Huge Band-Aid. Multiple Band-Aids. Unless yeah, anyway. So, and that's, for example, we love to talk about diabetes. And that was exactly what happened. Now, the body has been showing the signs of insulin resistance, but all the lab looks normal.
Yeah.
Until the glucose goes over 100, until A1C go over 6.2, 6.3. Now we diagnose people with diabetes.
Right.
Now we start to do something.
Right.
But it's too late.
Right.
Now we can always put it into remission. We cannot say reverse, but we can put it into remission. But why we want to do that?
Right.
If you can prevent it, not only we can prevent it without that diagnosis, without that diabetes medication. Look at the health, the wellness before you get diagnosed with diabetes. Now, with that chronic inflammation, insulin resistance, your body feel fatigue. Now, you have brain fog. You don't have energy.
So normally what chronic inflammation associates with, I should say that the illness, the disease that normally associate with a chronic disease. Can you give us some
how much time we
examples?
have?
It kind of go down to the list, and so people have an idea this is part of them, so they can tune in for more education in the future from you.
The most common one, brain fog. People always say, "Oh, it's aging, it's brain fog," but it's a build-up of chronic inflammation. Second thing we usually talk about is joint pains, muscle pain. You wake up in the morning, you have pain. Pain is one simple signal of inflammation. No, unless you have acute injury, all those pain, chronic pain, is coming from the inflammation. You have to treat the root cause, of course. If arthritis, why you have arthritis? No, why you have muscle pain? Maybe you're just bending on your foot too much or whatsoever. No, you have to treat the root cause. But then that's signs of inflammation. So pain, all those, and then weight gain. Weight is one issue. Now, gradually increase your weight, that one. And also for your skin. Skin is very reactive. It reflects your general health very easy. And so people a lot of times say, "Oh, I have asthma, I have allergy, everything I touch, everything I eat, and I have the rash coming up." That is a very simple sign of allergy. Inflammation. So a lot of times people say, "Oh, my healthcare provider wanna check my food allergy, and I'm allergic to multiple foods, even simple food, daily foods." Why? It's not because you're allergic to them. That's because your body has hyperreactive inflammatory responses. And just that energy that you go out, you bang your muscles, you got a bruise on your skin, on your on your arm, for example. When you have a bruise there, no matter what you do, you just light touch anything, you cause pain. And so if your body has a lot of inflammatory responses going on, it's very easy for you to get the allergic reaction regardless what you eat, regardless what you touch. That's from maybe you're allergic, more sensitive to those stuff, but it may not be allergic to that. Simply because your body was in a hyper-inflammatory stage, and then it's highly reactive to anything you get.
It's just like your body is so sensitive, and then whatever you do, just a simple touch, the alarm will just go off.
Yeah, we call it someone that's very touchy, right?
You know, so you actually talk about all this so far is you're describing the symptom. Like what kind of a sign is called a symptom that alert us, hey, my body is inflamed. Also, some people can feel it's like, you know, no matter what I do, that's like I'm very touchy and it's just like it doesn't go right. Also, it's just like you feel like at the end of the world you are going nowhere. So that also associated with the mood, right?
Yes. Yes. Yeah, we're not going to talk about the hormones, the teenager, the menopause. We're not going to touch that yet. Maybe the next topic. But so after we look at all the symptoms we may have, and let's look at the common sources of inflammation. Where we get that? What would cause that?
Now,
And,
hold on. Before you move on to there's one big subject. I also
okay.
heard a lot of people mention that gut discomfort,
Yes.
gut health. That's a big thing.
Yes, that is one of the things is the common sources of inflammation. The big one is your gut.
Okay.
So let's start from simple thing, diet. The food we eat will cause inflammation. The digestion process is an inflammatory process. Or the food will be anti-inflammatory, reduce inflammation. So just remember the food we eat either induce or reduce inflammation. And what is a perfect example? No, you mentioned your bug bite.
Yeah.
Why you have that huge reaction? No, number one, of course, you got a bite, the tissue damage.
Yeah.
And number two, there may be bacteria inside, and there may be just saliva from the bug.
The bug.
Right. So all those will cause a reaction. We call it allergy, stuff that cause allergic reactions.
Okay.
So what are the characteristics we just talked about? Number one is foreign, right? It's not coming from your body.
Foreign.
It's a bug. It's foreign. Number two, most of things are protein, right? Your saliva thing, your bacteria. Oh no, when you talk about virus, we talk about antigen, how the virus will attach to our body, how our body recognize bacteria. Mostly it's from viruses based on their protein. So they are foreign and they are mostly protein. What food people eat match that criteria?
What food? Like
Yeah.
animal product and protein. And like dairy. I think that's the most common thing.
Yes.
And
Milk.
also processed. Yeah.
Milk.
Milk.
It's
Milk and
foreign.
cheese.
It's coming from the cow, not
Yeah.
human. And number two, what they have inside. People always talk about, oh, it has a lot of protein. You want to get protein from there. So it's from cow, it's cow protein. And the body will react to it. And that is one major source of chronic low-grade inflammation. It's low-grade because it's so low that the body, we don't find it in our tests. So there is one big category to have this information. And another thing, a big thing is sleep. If we don't have good sleep, no, we get tired and we have cortisol, high cortisol, and the same as our stress And when people think about cortisol, they only think about, oh, they increase my blood pressure. But poor sleep at the same time will also give you low-grade information through the hormone. And also when you don't have a good sleep, you tend to overeat. And what you like to eat is high salt, high fat, high sugar. And those are very inflammatory too. Refined sugar, we all know that get you the insulin spike, and then you will easier to lead to insulin resistance and diabetes. And then diabetes will cause a lot of complications coming from going into your arteries, the heart disease, going to your brain. We call it type 3 diabetes, and then going to your nerve. We have the neuropathy. And they reduce your immunity, affect your eyes, affect your kidneys. It's all coming from that simple information from diabetes. That's with highly processed food, sugar, and fat. And people usually say diabetes is a carbohydrate issue. It is refined carbohydrate issue, but the real cause is too much saturated fat inside the muscles. As I previously mentioned, that muscles is the largest organ to use glucose. So when you have too much saturated fat inside the muscle cells, the glucose is not able to go in because the insulin is not going to being processed by the cells. Because the insulin is the key. It has to attach to the cells and then telling the muscle cells to open the gate for the glucose to come in. And when you have too much saturated fat inside your body, inside the muscle cells, when the insulin attached to it, the gate is not going to open. And that's why we call insulin resistance. So all those food will gradually cause inflammation inside there. And exercise too. If you don't have enough exercise, they will cause inflammation. At the same time, if you over-exercise, that is another thing that will actually cause some oxidative stress, give you a lot of inflammation. Because remember, when we exercise, we'll break down the tissue. We'll break down the muscle fibers, will tear it down. They'll have inflammatory response inside the muscles. And we need a lot of energy for our activities. And that's coming out from the mitochondria, the power plants inside the cells. And during this process, just like you imagine that we are back to the old days, we're using coal to produce power. We have to burn the coal, and then they will have some side products that will cause environmental issue. That's why we don't use it now. But it is the same thing when the mitochondria produce ATP energy. This process also create a lot of reactive species. So those oxidative stress are very inflammatory. So there's a balance, even though exercise can reduce inflammation, but if you're over exercising, you have increased inflammation coming from mitochondria, coming from extra breakdown of your muscle cells. So that's a fine balance right there.
Yeah. So Dr. J, you talk about the cause, like the symptom looks, you have a fatigue and you have you feel like a brain fog, tired, your muscle weakness, those are the symptoms. And you also mentioned about the cause of inflammation, the foreign ingredients such as the milk and the type of protein, the sleep and exercise. And you mentioned about diabetes. So in terms of that, what are the illness actually? It's also it also consider a body inflammation and those illness actually associate with the chronic inflammation. So beside the diabetes, what other illness are considered?
Heart disease is a big one. No, and neuropathy actually is a big one. People don't usually recognize. No, people have that neuropathy. They think it's coming from diabetes is number one.
Mm-hmm.
And another time they have that is called idiopathic, just no reason.
Mm-hmm.
But a lot of time it's just coming from your low-grade information, too much
Mm-hmm.
information right there, and
Mm-hmm.
the cause that. And another thing is what people usually like to refer to as, for example, fibromyalgia.
Mm-hmm.
That's a pain over the body.
Mm-hmm.
Sometimes it happens here, sometimes it goes over there. No, that type of pain is very indicative of inflammatory responses.
Mm-hmm.
It's not set to just like you have an injury, so you got an injury on your right leg and the pain is always right there. Then you know it's coming from injury. But when you find that generalized systemic chronic inflammation, the moves are wrong.
Mm-hmm.
So that's one. Arthritis is a very good example also.
Mm-hmm.
And those are the things that are highly related to the, we call it chronic systemic low-grade inflammation.
How about cancer?
It is possible. It is also the inflammatory type of responses.
And the brain, the emotional health, such as depression?
Yes. Yeah. The inflammatory response is going to your brain. That will cause the imbalance of neurotransmitters,
Mm-hmm.
and that will have the emotional consequence.
So, my goodness, fine, emotional consequence. And then, so one of very hot topic right now is the brain cognitive health dementia. It's also associated with chronic condition,
Right,
the
right,
information condition.
right. For
Okay,
example, as I mentioned, the Alzheimer's, sometimes we call it type 3
type 3.
diabetes.
Yeah,
It's coming from insulin resistance and too much glucose inside the body, like that.
I see. Okay, so now in terms of the the general heart disease, I also see there are a couple specific diagnosis actually associated with heart disease. It seems like a big umbrella, but there are some diagnoses that associate with the general heart health, such as hypertension, the blood pressure level, and also the cholesterol.
Right,
Is that right?
right. So one thing about the blood vessels is when you have insulin resistance, they started to change the soft tissue.
I
And you
see.
think about the blood vessels is all made of collagen. Also, the easiest example will be diabetes. So the diabetes that change the properties of soft tissue, and now your blood vessels are not as flexible. And then and even worse is when you have cholesterol issue, all those saturated fat going into the blood vessel wall, and that's how you get the plaque. Now it becomes thick and interfere with the blood flow, and then also less flexible. When you don't have that much flexibility, when you reduce the flexibility, the the heart has to pump harder.
Oh,
And
see.
that's how you have hypertension.
Yeah.
Your blood pressure goes up because the heart has to pump harder.
Yeah. Yeah.
So that's another thing connected to it. And of course, with the cholesterol, and you get there, you have the plaque, and you reduce the flow even further. And sometimes you could even have the hemorrhagic type of stroke. The blood vessel just broke, or you can have the other type that you just don't have enough blood flow because the blockage of the circulation. And then you have the blockage in your heart, blockage in your brain, and that's how you get loss of functions of the heart and brain.
That really makes sense. Now I can see that whole picture. Really, our body is connected, so all come together.
Thanks for joining us on Healing Step to Wellness. I'm Dr. J,
I'm May,
guiding you to whole person health one step.
and one bite at a time.
See you next time.
Bye.
Bye.
Healing counting the steps to wellness. One step, one bite each